recording is started. I'm going to stop sharing and turn it over to you, Elder.
Okay, let's come together in heart and mind and spirit. Father, Mother God, we come before you, giving thanks for your blessings, for your mercy, for your grace. We call you mighty God, gracious God, loving God. You're the healer, you're the provider of all that we have. Your spirit pervades everything that we know and everything that exists. We give thanks as well for our ancestors upon whose shoulders we stand. We couldn't do this work today without you. If you didn't have the resiliency and the grit to go forth in a very difficult time and stay the course, we wouldn't be here today. We thank you as well for the elders who have gone forth and worked for decades to bring this day forth. We ask for your blessings upon them for stabilizing their health and strengthening their body, every cell, every tissue, every organ, that they can continue to go and see the day that you have provided before us. We thank you for the young people and their vision that will carry us even further down the road. We ask for your blessings upon this meeting and this presentation, your inspiration, your guidance, your revelation. We ask this in the name of that which each and every one holds sacred, and I say in the name of Jesus Christ of Nazareth, amen. And so tonight we have, I brought
Amen.
a guest tonight, and I thank you all for being so gracious to allow her to present. I serve in several different capacities, one of which is with her project she has that deals with infant mortality and birth equity, and she will talk more about it. So I won't get into her time and space for that. She is Dr. Charlotte Smith, and she can share more with you. She has some presentation, I believe, and also a video. So you can take it, Dr. Smith.
Greetings, everyone. Thank you so much for your time, and thank you to Prophet Cox for the invitation, and thank you guys for generously hosting me tonight. I am happy to be a part of this conversation. I'm going to share my screen. Please let me know once I start the video if you can hear it, just to make sure that the sound is fine, okay? So tonight I'm going to be talking about First Do No Harm, combating Black maternal and infant health disparities. But I first want to start with a video that's very important to this work. Let me try just to share the video.
We're talking about women that spoke five languages, that race cars, that was so compassionate, so loving. We were always kind of joke, our life is like a movie.
Breaking up a little bit. Is that on my end or is that?
So, oh, have you gotten that? Oh, how the hell did you do that?
I think this is planning.
Is that a YouTube video that we could also get a link to, or is that something in your internal computer?
You're muted, Dr. Smith.
It's in the presentation. It just happened to start playing in the presentation and on YouTube at the same time. So I'm going to try this again. Is that okay?
Of course, go right ahead.
Sorry about that.
No worries.
Can you guys hear it?
Not yet.
No, the sound, did you click the sound options at the bottom left? You may have to stop sharing and then restart, and then make sure you click on this share audio. No, you have to stop sharing your screen, and then when you start again, make sure at the bottom left, those two boxes are clicked.
Okay. I do this all the time, so it shouldn't be that difficult. Let me try one more time. I do this all the time, so I don't understand. Okay, so hit, let's see, share sound. Okay.
Yes.
There we go.
So compassionate, so loving.
We would always kind of joke that our life is like a movie. Where we at? Oh, there's a fish. You don't see the fish around y'all? Look. That's a nice dress. But I like that one better.
You got me this?
Baby.
Baby, this dress is gorgeous.
Baby. Woo! So, mommy, where you at?
Beautiful Palm Springs. Daddy surprised me and my little munchkin man. I love you.
Kira and I, we always wanted back-to-back boys. When we found out that we were welcoming another boy, we were just, ecstatic. Kira was exceptionally healthy. Every single prenatal visit that we went to, she got great reports. The baby was healthy.
Hi, Daddy.
Hey, Winston.
Hi.
5 minutes.
All right, let's go, guys. All right, sweetheart.
Ready to go? You want to walk, okay?
Hey, Langston. I've been waiting on you, buddy. Everybody's here to celebrate. I really don't know that there's any other emotional experience that you can compare to that, right? Being in the delivery room when your son is born with your wife and, welcoming him into the world. It was an amazing, amazing feeling. Shortly after Langston was born, they took us back to recovery. Kira's sitting there, and I first noticed that there was blood in the catheter at her bedside, and that was the first sign that I realized that something wasn't quite right. I brought it to the attention of the nurses and the doctors. They ordered a CT scan that was supposed to be performed stat, right? And so stat, in my mind, I'm thinking that means immediately. She's beginning to tremble uncontrollably. She's beginning to shake. She's beginning to be in increasingly more pain. There's still no CT scan. The doctor's walking next to the bed, and he says to me, I'm gonna fix it, and she'll be back in 15 minutes. She'll be back in 15 minutes. And that was the last time I saw Kira alive. They told me that there was nothing they could do to save her, that she was gone. A wife that wasn't just in good health, but was in exceptional health. And not walking out is something that I never conceived, and even 2 years later, I still can't make sense of it in my mind. Who's the best big brother? Where's Langston? Show me Langston. Where's your baby brother Langston? All right. Say, I love you. Blow kiss.
And then less than 12 hours, she's dead. They said, oh, had we gotten her back into the operating room, she would be perfectly fine. Oh, if we had. Well, why the hell didn't they? It was not that she was sick. It's not that she had a pre-existing condition, that she had a heart problem or she had a blood clot. None of that was Kira's case. We walked in for what we expected to be the happiest day of our life.
and we walk straight into a nightmare.
So I know that that's hard to see, but the reality is when this happens, more often than none, can you guys hear me? This happens to Black women.
Yeah, we can hear you. Go ahead and put your stop sharing, or is this the presentation?
This is the presentation.
Okay, go ahead.
So this happens to Black women 3 to 4 times more than white women during childbirth. It also happens to Black infants. They are 2 to 3 times more likely to die at birth than white infants. Each year, more than 50,000 women face threatening life conditions during childbirth, and each day, 137 women suffer life-threatening complications from childbirth. In the United States, and also in the state of Kansas, these rates are worse than they were 15 years before the end of slavery. So Black moms and Black infants are dying at rates higher today than they were 15 years before the end of slavery. So Kyra's story is not unique. What we know about Black maternal mortality is that we know about 3 in 5 pregnancy-related deaths could be prevented. They are closely related to heart disease and stroke, and often called pregnancy-related hypertension, which leads to preeclampsia, which then leads to eclampsia. And so if you're guessing what hypertension is, that is high blood pressure, and it is treated with 80 to 160 milligrams of aspirin. So we are losing Black women at childbirth because of a $3 prescription. About 700 women die from pregnancy-related complications each year in the US. What we often talk about is the social determinants of health, because we say that the social determinants of health can explain these disparities. The realities is they can't. So when you look at the social determinants of health in this chart, it shows that 40% are socioeconomic factors, 10% is physical environment, 30% is health behaviors, and 20% is healthcare. So most of our social determinants of health come from our socioeconomic factors: education, job status, family support, income, and community safety. And some of them, a small percentage of them, come from healthcare, in which we are tackling each day to reduce biases in. But 30% come from our health behaviors, which are directly tied to our socioeconomic factors. If the social determinants of health is a problem in the United States, then why have we not made any progress to reduce the income and wealth inequalities between Black and white households over the past 70 years? Are we really talking about social determinants of health? Or is that an excuse? The other thing is that when you look at Black maternal and infant mortality, the social determinants of health that you saw previously, they do not matter. So these socioeconomic factors, physical environment, health behaviors, and health care do not matter when it comes to Black infants and Black women's health, because Black mothers who are college educated fare worse than mothers of all races who never finished high school. And obese women of all races have better outcomes than Black women who have a normal weight. Black women in the wealthiest neighborhoods do worse than whites, Hispanic, and Asian mothers in the poorest ones. And Black women who initiate prenatal care in the first trimester still have rates of infant mortality that are higher than non-Hispanic white women with late to no prenatal care. So this rules out the social determinants of health. Not only are we using them as a crutch to say that if you're poor, then you will not have a healthy pregnancy or a healthy infant. We are not addressing social determinants of health. When we look at the social determinants of health, it does not matter when it comes to Black women and Black infants' health. The story we're really talking about is not race. The story is racism, which comes in many different sectors, whether it's institutionalized, personally mediated, or internalized racism. These are the factors that we are dealing with as it relates to Black maternal and infant health. What we're doing is we're trying to really focus on birth equity, which is not equality. Equality means everybody gets the same thing, but equity means that we are to assure that everyone gets an optimal birth no matter their race, no matter their SES status, that they have an optimal birth, right? And what birth equity also does is it shifts from blaming women for poor health outcomes to system level accountability for programs and policies. Because when we start the conversation about social determinants of health, what we're really saying is because you're poor, because you live in a certain community, because you don't have access to things, then that is why you have these outcomes. When the reality is these are systemic issues. And if we don't begin to address the systemic issues and racism, we will not be able to reduce these numbers and these disparities. And so one of them is just starting to listen to our women, but I'll tell you about some of the work that we've done. We work with the Divine Nine to really participate in community engagement. Divine Nine are the fraternities and sororities. And so we started this work 4 years ago in Kansas, working with them to really increase awareness around African-American and Black infant mortality. And the reality is a lot of individuals were not aware of the disparities, are aware of the fact that this has been happening in Kansas for over 30 years. Yes, in Kansas for over 30 years, Black infants have been dying at 2 to 3 times that of white infants. What are the causes of most of these deaths? Low birth weight and preterm birth, which means a baby is born too early and is too small. That is the main cause of this infant mortality disparity. So we started to work with these fraternities and sororities to really increase awareness around this issue and to really empower Black families and to talk with Black families about their experiences. So starting with a model from the ground up, from the community itself. And we started with kind of listening to the women, trying to figure out what was happening, what experiences are they having, not just in the health care system, but in their communities as well. How are these disparities affecting them? And I would just say that the basis of our medicine is do no harm, right? And we are seeing that if you are Black, that is not often the case. And it's not fine that this is the basis of our medicine and it's not true for a certain race of individuals. Black women whose bodies were used to determine the best practices for OBGYN. Many of you may remember Dr. Marion Sims, who is the father of gynecology, who mastered the cesarean, the C-section, did that on Black bodies with no anesthesia. And his statue was just removed from New York in 2017. So it's not okay that Black bodies were used to determine the best practices for OBGYN, but they are dying at 2 to 3 times the rate of those that are not Black. And Black infants whose lives were used for productivity and economic gain during slavery are dying at 2 to 3 times that of white infants. As a matter of fact, when we look at this data, the data during slavery was more accurate than the data we keep today. And so we asked women about what was happening in the satisfaction of their care, birth experiences, postpartum depression, and birth equity. And we asked them about satisfaction. Well, that's one thing that never happens. We never ask women about the satisfaction of care during a doctor's visit. And so the women stated that the physician just turned a deaf ear to them, didn't listen to them, didn't follow their plans, or they waited so long to receive treatment. We asked them about birth experiences, and of course there was a need for advocates. There were a need for Black women to be at the table in concerning their care and being a voice of their care. There were also lots of questions to women. Were they married? Are you married? Where's your husband? Where's your mate? And so those questions are questions that they have to deal with when they're trying to seek care. Fathers also have experiences in this, and these are not good experiences. What we hear often is that fathers are not acknowledged when something happens. They are not spoken to. They're not acknowledged when they walk into the room. And so they also have a role in this. And one of the fathers told us that there were times when the doctor was not treating his wife well, but he didn't want to speak up or say anything because he didn't want to be perpetuating a stereotype, and he did not want to be kicked out of the hospital or worse. And then we have women who were never truly asked if they suffered from postpartum depression or had any issues postpartumly. In the state of Kansas, you only have one postpartum visit, which is between 6 and 8 weeks, because we've not done any Medicaid expansion. And so you're only seen once after delivering a baby. Yet you're 3 to 4 times more likely to die within that first year of giving birth than any other race. Also, we saw that people needed to be at the table. They need to be institutions that train people, that listen to people. We do not have enough African Americans at the table. We do not have enough African American care providers in our community to really provide the care, the intentional care that is needed to reduce these disparities. And so what we did to address that is we started the Kansas Birth Equity Network. The Kansas Birth Equity Network is what Prophet Cox is involved in, and it is really a mission to create a community-centered approach to create solutions that improve Black maternal, paternal, and infant health in the state of Kansas through training, research, healthcare, and advocacy. Because our vision is that every Black birthing person, dad, and infant receives quality and intentional prenatal, neonatal, and postpartum care in the state of Kansas. And how do we do that? First, we start with education. We must educate our Kansas Birth Equity members on what is happening in these disparities, what we're seeing with these disparities, and how do we begin to address them. And so we started with the birth equity curriculum that really exposes them and creates this awareness around this disparity, and also prepares them. It's a readiness activity that prepares them to work with us to create solutions to reduce these disparities, because we know that it will take all of us to do that. And so we bring together a group on a monthly basis to really discuss solutions. How do we create solutions to make a healthier community for all Black moms, dads, and infants? We also have an event every year where we change the subject. So rather than talking about infants that are dying, every year we do an event called Celebrate Day 366, which actually creates a celebration of infants that are living past the 365-day mark. So this is an opportunity to create that awareness, education in our community, but also to celebrate Black babies living past the 365-day mark. So the idea is that every year we will celebrate more and more Black babies living past 365 days, right? Which means they are no longer experiencing infant mortality. And so this year we have a weekend virtual event, and Friday is our community resources. So we want to create awareness around what resources are available to our community, how they can access them, who to contact. We also do panels, and the panels are really focused on the state of Black parents in Kansas, and then the state of Black fathers in Kansas. So we always have a father component, because we must stop having the maternal and child health conversation in the absence of fathers, especially since a CDC report told us that Black fathers are 40% more likely to be in their children's lives, eat dinner, take them to school, do activities with them daily than any fathers of any other race. So Black fathers are involved. And also on Sunday, we have a Celebrate Day 366 Birth Justice Walk Run to really solidify this activity. This year, we're doing something a little different. We want to celebrate Black babies. So we are having a Celebrate Day 366 Black baby photo contest. And this is an opportunity for people to enter their babies into a photo contest, that baby to become a part of all of our ads for the year, and to win an incentive. So this is our opportunity to celebrate Black babies. So this event is really turned from talking about the maternal and infant mortality rates to really celebrating the Black family and celebrating the Black baby. So really changing the subject. We also have the Celebrate Day 366 Birth Justice Walk. And so that is the opportunity to do that virtually and to really solidify these activities around exercise and working out and coming together even in a virtual setting to celebrate the lives of Black families. And so if you have any questions about that, I'll stop here. This is a way to contact me. So the Kansas Birth Equity Network is just a year, so it's still in its infancy, but we are really working to create birth equity and intentional care in the state of Kansas. I am the lead of this project. My co-lead is Dr. Michelle Redmond, and our research assistant is Aluma Obai. And we also have community advocates that work with us in the community to create these activities. And so we have Joy Barnes, who is doing the Celebrate Day 366 lead. And we also have Father Engagement lead, because again, we believe father engagement is needed. You can put your cell phone to the scan bar on the computer, and you can fill out a little form that you want more information, or you want to get in contact with us, and we will be in contact with you. So I'll stop here and see if there are any questions. Thank you for your time.
Thank you. And so let's go ahead and open up for any questions. I do have some questions and comments at the end, but it's open mic, and any questions? There's 550,000 Black babies born every year. Is there any questions from anybody on the line?
Yes, I have a question.
Go ahead.
Okay. Basically, you know, like I'm in New York and New Jersey area. And, you know, from the youth, I learned a lot of things. Is that one thing, you really have a real issue about arguing with Black females. You know, it seems like they have this thing that, you know, you don't want to argue with a Black female because they have the position and they talk a lot. That even deals with the issue of the phone scenario. That they talk about.
Wait a minute. Phone scenario. We're talking about Black babies, Black infant mortality, Black women dying during birth. I'm talking about any phones right now.
I listened to the whole thing, and if you would allow me to just to finish my question, okay. The question is, as far as dealing with the relationship between men and women, especially within the Black, you know, community and relationships.
But
and
that's not the question.
family.
That's not the question. So thank you very much.
So Andrew, give me the relevance of what you're talking about to the subject matter.
It deals with relationships and the health of the care of the family.
Yeah.
Okay.
Okay.
As far as how we
I apologize, but that's not the topic.
Okay,
Thank you very much.
treat one another.
All right. Any other questions?
I'd like to just say a few words, if allowed. This is Guy.
Speak up.
Okay, thank you so much. No, I just want to say thank you to our sister for this brilliant expose. This is something that we need to hear. We need to let people know. And in the light of the forum that's coming on with 71 countries, I think some of the things we are doing here, a lot of countries will really, who have a significant Black population will really benefit from some of the work that you are doing. I'm saying that knowing that when you compare what we have here in the US versus what we are actually in heaven, even though we know that we have a lot to do in terms of equity and a gap, but still. So I just want you to know that the work that we do, I really appreciate that. And the partnership that we are building with Brother Daniel is going to make sure that the other countries from around the world benefit greatly from the work that we are doing. That's all I wanted to add. Thank you very much.
All right.
Thank you so much.
Thank you. So let me make a statement that when we organized last Friday in Kansas, and so under the FAU model, each state gets to choose with the African Diaspora Directorate what it will specialize in. I would recommend, and I will send you the information to have this specialty, because we're now determining over the next 6 days what we're going to report to the United Nations for the permanent forum on people of African descent. You have set out here in Black women in the United States that we may have a serious problem that we're not necessarily addressing. My cousin, who is a past president of the National Medical Association, they just had their national convention. I just took a quick look through the agenda, and this wasn't one of the items on the agenda. We look forward to working with you and your group to make this an item on the agenda about this, because operating in the women in the United Nations has the CSW, the Commission on the Status of Women. And so that's one avenue for 2022. But there is another avenue, which is this newly established forum, and the women getting established in that forum. I definitely want to talk to you and your organization, and we need to make it a data-driven project in one area, which I heard you doing. And in Kansas, there's 2,500 Black babies who are born every year. And so versus 15,000 European and et cetera. So let's get some data. I like that you're doing the data driven. Okay, and so you are part of a already established National World Conference of Mayors, Historic Black Towns and Settlements. And in September, we have the upcoming National Policy Alliance Forum. So let's, over the next 6 days, I will be in contact with you so that we set the agenda in the upcoming forum for people of African descent in 2022, where we are calling on these calls to bring together that agenda that we will submit to the United Nations this coming Sunday. And so tomorrow's Health Day, okay? And so I'm glad that you had this today, but tomorrow specifically is that all our health providers are coming into that. And they're coming in on the basis, okay, they are coming in on the basis that Glendora Claybrooks, who tomorrow, she's helping write the universal healthcare plan for the state of Oregon, officially as the state. And so, you need to speak to people like that so that we can turn that over to you. As I always tell people, I'm not trying to have an 8th heart attack by trying to be everything. This is an area where, we as men, yeah, we help, but it's a women's issue, women-driven issue. But I'm glad that you take into consideration men in the birth of their children and in the birth of the family, and that you made that, okay, an issue for men in that participation.
Excuse me,
so,
Herschel.
Let us continue to integrate from Kansas, okay, this program to bring others in it, to bring it to fruition with all of the women who are in Blacks in government and others. Yes, Andrew.
Yeah, before Dr. Smith leaves, Dr. Smith, do you have another 5 minutes or so before you have to leave? I wanted to share some information with you, but if not, I'll just send it to your email.
Yes, please share it. I'm still waiting. I'm waiting on family to arrive, but their flight has been delayed.
Okay, good. Herschel, this speaks to a very important issue, and I'm glad Guy spoke up, because as I understand it, the UNESCO clubs are very much aware of the Sustainable Development Goals. And in particular,
very true.
And in particular, I need to bring to your attention that the United States is very much not aware of the Sustainable Development Goals. It was Howard University that functioned with the Sustainable Development Goal Network that June of this year produced a report showing that in the 50 United States, none of the 50 states are even 50% focused on achieving the Sustainable Development Goals. And those communities that are most left behind are, in fact, the Blacks, the Latinx, and the Indigenous Peoples. So, Ms. Smith, what I've asked Elder Prophet Cox to do is to embed in your narrative the importance of what you're doing there on a global scale. We call it globalization. So the idea is to demonstrate how your effort, how your study, how your data has implications throughout the entire country and world. But in the chat, I put a series of links there that you please share. And I do want to make it clear that until we ourselves empower ourselves with the language that's being used by major corporations and the media, then we're going to continue, unfortunately, to be left behind. So Dr. Smith, I just asked you to save the chat before you leave, and then you'll be able to walk through the content. And specifically dealing with racial justice issues, we can take the lead ourselves in being the champions of these issues with Guy, because in the United States, for example, there are 763 members of the United Nations Global Compact out of 13,000 worldwide. If all we do is add 100 more, you can see the impact that if we all are collectively working together, we could have on this forum. But again, if you're talking about the historically Black colleges and universities and the students there, it's important that we educate them about these tools, Dr. Smith, that we can use to leverage our impact worldwide. So thank you very much. I'll yield the floor.
Thank you, Andrew. Guy, for UNESCO, and this comes into the scientific, cultural, and educational, very much so in terms of this, Doctor, that one of the things is we develop this agenda. Again, as Andrew said, what we're doing is providing the connectivity that's at 40,000 feet with the SDGs, bringing it down to the United States in a review of human rights that's going on right now. It's going on right now, okay, from the United Nations. We're in the third cycle in solutions, then bringing it down to state via the African Diaspora Directorate and into local with this agreement with UNESCO clubs, centers, and associations so that we can motivate. And so the reverse would happen in this case, taking from what you're doing in Kansas and the basis of what you're doing in Kansas as part of a expansion of the FAU, UNESCO clubs, centers, and associations to embed in Kansas this to feed into the system. Okay, and so that then the whole idea is to create within the 6 days, okay, there's a whole agenda that we're including for the Commission on the Status of Women in 2022, but there is yet to be established the equivalent in the permanent forum because we're just in day 2 of the permanent forum. But we had planned on this in 2019. Those of us who have been involved in this since 2012, okay, in putting on that, we're planning on that. And so this is one of the things where the plans meet the road with your program and we could turn it to you, okay? And I look forward to doing so.
1 more minute, if possible. I'd like to add something else.
All right, Guy, go ahead.
Okay, thank you so much. I just want to say, Andrew, you are so right on this. Is this not new for the US not knowing what's going around the world? This started since the Millennium Development Goal. I remember when the Millennium were adopted and the US signed it, I was trying to go around talking about the Millennium. Nobody wanted to listen. Okay, it wasn't a priority for us, and just like it's the case here. But I just want to take a quick minute to say to Dr. Smith that this is very, very important. And what you say is very important. It's at the international level, it's almost all issues that we are facing, any problem we are addressing could be targeted under one of the 17 goals. And hereby, I think Dr. Smith could easily fit goal number 3, which is about health, as well as goal number 11, which is about sustainable development, because sustainable cities, because again, with the disparity, with the lack of equity between our children, we could not talk about sustainability. But the third point I wanted to make is that I've also been attending last number of years, the UN Women Conference, biggest conference that happened in March for almost 2 weeks. I think that we should be able to work with Dr. Smith to have a presentation, either side event or at the main event, to have her do this presentation, because I'm sure that with her doing this over there, a lot of people from the countries looking like you and I will be benefiting to connect with the work that she's doing. Thank you.
Thank you. One of the last that I want you to be aware of, Doctor, is the plan in Africa. See, the connection of this permanent forum is 1.6 billion people worldwide of African descent. Over 800 million of them are girls and women. And so one of the things that is being put together is a plan of action. You know, you quoted some stats relative to slavery and birth versus now. And one of the reasons I assume that you are able to do that is because as property, you keep track of, it was a management system that people don't understand. It wasn't a fly-by-night system. It was a state-of-the-art business process that was a world-leading process. Okay, it wasn't railroads and industrialization that was America's first international business. It was agriculture driven by enslavement of Africans, and they kept records. And we now have those records. And I commend you for doing an analysis of those records relative to this issue. It's not done normally, but thank you for doing that. And let's expand on that. Like I said, I looked at the National Medical Association, and John, I see you, okay, that they just had their conference. There wasn't a track on this. Okay, we can put a track, as Andrew said, we can create that track. I looked with Commissioner Cox, yourself, and the other women and those who are interested on this subject. But let's get that out of Kansas for what we're doing in FAU in Kansas and bring it to the table. John, you had a question?
I just want to add to that, Dr. Smith, I represent, again, the indigenous people. I'm from the Caddo Indian tribe. And I recently have been speaking with, regarding the Nicodemus event, Haskell Indian University in Kansas. And Dr. Wildcat and I have spoken to some of these issues because it's also an issue for indigenous people worldwide. And so, especially being right there in Kansas, I think it would behoove all of us to integrate, again, what we can with the indigenous people for our challenges. And somewhat related is, sadly, indigenous people have the highest suicide rate of any race of youth and children.
So we will, at the Indigenous Peoples Forum, on Sunday is the International Day for Indigenous People in the United Nations. And so what we're doing in 6 days is we are submitting for the 2 tracks. One is the Indigenous Peoples Alliance, which was born out of the 20th meeting of the Indigenous Peoples Forum, and then the specific for the permanent forum. So it's a little bit of studying to come up with, but the short of it is, this is ground floor. You made us aware of the issue. Let's run with it. All right. Any additional questions?
I just say
relevant questions. Commissioner.
No, I just said Ashe to all of it. It's great. That's why I told her to come. This is a great place to bring that. So thank you.
Well, I appreciate that work that you do, Commissioner. Okay, and so I'm gonna from now on refer to, because see, Commissioner Cox serves on a vital commission of the 400-year history of Africans in the English colonies that became America. And it's a basis for what we do and Friends of the African Union and our allies in pushing for an economic review of the United States and our place as in it. It's not a narrative review like the 1619 Project. It's not a theory-or review, but rather it's a black and white. What the doctor did is a black and white. You go back, you go to the slave plantation records, you take the analysis of that they have. A birth is given, okay, et cetera. So those are records that are there, and that those are records that apparently that they've done an analysis of. And I'm shocked actually to hear that our record keeping now is worse than the record keeping then. But that's what COVID has done, is given us the impetus to know that. And the key is that the Biden administration has now committed itself on day one to address racial inequality. And so this is your area. Welcome to it. We'll give you the platform. You get to run with it. Okay, you have the background, history, and we look forward to working with you to make this happen.
Herschel, one quick correction is, as I am a member of the commission, I cannot represent the commission without their vote and approval. So when you all get your letter there, wherever, however we connect,
Letters going out tomorrow.
And so otherwise, I'm here as an elder, I'm here as a Black woman and a person in community and a 71-year-old who want to see change and a lot of other stuff. But as the commission, I can't speak for them.
Oh, yeah. Making it plain, I'm sorry. I was making people know who you are when I refer to you as commission, okay? But not that you're speaking for the commission. And we've said that before. Organizations that speak for themselves on these calls, okay, for them, the doctor speaking for her organization, et cetera. We're speaking as a member, Friends of the African Union, that organized in Kansas on last Friday in Nicodemus. And that the letter that is going to go out from this group is all around the permanent form and organizing, as Andrew mentioned, here in the United States to bring all that in place, because Friends of the African Union has with the UNESCO a letter of intent that we're executing to create a infrastructure that brings the scientific and the cultural and the education that UNESCO is noted for down home, okay, and bring it to Kansas. All right, so good.
Great place to be, Dr. Smith.
I just want to thank you guys again for giving me this platform and letting me talk about my work. I have to go, but I want to mention that I put my contact information in the chat. Please let me come back to hear more about your work.
All right, thank you very much. And we'll email you. All right. So going on, what we will be talking about is Guy and UNESCO. In terms of, you gave a short discourse yesterday on UNESCO in terms of following on, talking about the UNESCO clubs, centers, and associations. Now, Friends of the African Union is looking to become one of the associations that our whole network then creates clubs and center program within that. So tell people more about how this works in the United States and the United States rejoining UNESCO. But meanwhile, the US network that was created before that.
Oh, thank you. Okay, thank you so much, Herschel. This is actually a question that some people don't understand, and I'm glad you are giving the opportunity to clarify. UNESCO, like I stated yesterday, was founded as a member state organization, but anyway, today I think I may go a little bit deeper how the civil society started, because we are coming to, you all understand about Hiroshima and Nagasaki, the anniversary is coming tomorrow, the next 2 days. So when UNESCO was founded as one of the UN entity to promote peace through education, science, culture, and communication, someone in Japan who has just witnessed who are just the only country to have received an atomic bomb, 2 atomic bombs, heard about the idea of a movement created to an organization, international organization created to make sure that we don't have a third world war, but not just as because people are going to be signing treaties, but because people will be going in the minds of people and trying to plant the seed of peace. He realized this idea was so, anyway, it is stated that the person heard about the idea of UNESCO and said, oh, this was too important to leave it in the hands of government, because until that time, government had a monopoly of, of terrorism, guns, and everything else, as it is in most cases. It's not the case today that it was, but the government was the one that created wars and stopped war and things like that. And this person in Japan, Sendai, in the city of Sendai, Japan, realized that, wow, the idea of a global movement that was going to use peace in the mind of people, it used education, science, culture, communication to really address the source cause of war, was an idea so important that we couldn't leave it in the hands of government. So he created what is known as the first UNESCO club. Okay, at that time, Japan was not a member of UNESCO, and Japan was not even a member of UNESCO. Okay, so he created the first club that he said, okay, we are going to take those ideas, and then at the local level, we're going to try to create programs to implement those ideas here. That's how the first UNESCO club was founded. And over time, the leadership at UNESCO realized that it was important to have a global movement. So they helped create and founded the World Federation of UNESCO clubs, centers, and associations. And the mandate was that in each country, we had a government supposed to be part of the organization through the National Commission for UNESCO, but the civil society, which the two were not supposed to be together. Okay, because the civil society, just people like you and I, at the local level, said these are great ideas. Let's create programs to help implement those ideas here. So, unfortunately for us, in many countries right now, I'm talking mostly like in China, in Vietnam, middle country, there's no clear distinction between the National Commission, which is the government entity, and the civil society. But the fact remains that at the World Federation, we as US are member of the World Federation. And the sole fact that the US government got out of UNESCO does not stop our membership from going on. So as a current member of the World Federation of UNESCO Clubs and Association, our membership goes on regardless. But because in each country, the National Commission, which is part of the government, is supposed to be overseeing the work of the federation, there's still some kind of what is going on. So, but we know when the Biden administration came in, we actually organized an event where they sent someone to talk about the US engagement with UNESCO, and ever since we've been promoting the return of the US to UNESCO, and we were promised that it was going to happen. Okay, because it's a member state organization. The relationship is not like the UN, the UNICEF and World Health Organization. We had a directive which is a lot easier. With UNESCO, there has to be a lot of negotiations, but the US is going back to UNESCO for sure. That's the direction, and that's what we were told. So with the development with the new forum of, I think this is going to actually be very, very helpful to us, because the US Federation under my leadership, has been working to create an event, a major event here. Initially, it's supposed to be in Colombia, but we decided to have it here for the people of African descent. I could see this as a real opportunity to be the first international, maybe one of the first international, this new forum will actually be involved in. Okay, I actually had a call today from the folks in Philadelphia that were really impressed by the commitment, what our ambassador at the United Nations stated about the support, and said, okay, we need to move this very quickly. So the other thing, so now you understand that our membership at the through UNESCO, the World Federation, is intact. Okay, it wasn't affected by the return of by UNESCO, by the US leaving UNESCO, but it will be helpful to have more credibility and a lot of access to more resources at UNESCO when the US got back to UNESCO. So the second topic I mentioned was about this big event. And due time, once we finalize the detail with the city of Philadelphia, I think we as the entity groups getting here today together, we actually going to play a critical role, a very important role in the planning and implementing on that event. Okay, that is going probably to be the tentative date is May 25 for about a week. Some of those ideas, just to give you some of the ideas that we had when we initially planned, was to have, like, we have a Grammy, right? The Grammy. Why don't have a Grammy for Afro and Afro descendants, for instance? Okay, that could be a venue to launch something like that. Some of these big event, motion picture, all these things where we have, we could have our own event to really identify Afro descendants. Why not give a top journalist prize to some of the Afro descendant, African or Africa descendant journalists? So this is just to give you a couple of ideas that we may actually see implemented at the next conference. Okay, I don't want to take too much time, but the last thing I want to say is that the partnership that we are working on is going to help. Each state in the US should have a chapter, which is not the case right now. So we know, being an African, being Afro-African American, I think we really lack in terms of participation of African-American. And I think that this is one of the best things that's going to happen, because working together, I think by next year, we could have a chapter incorporating almost all the states in the United States. So I'm looking forward to every single one of you playing a role to make sure that we have a national presence everywhere, so that Black children could take advantage as well as others to this the platform that we have been creating over time. Thank you.
So my question to you, Guy, first, thank you so much. My question to you first is, the organization that you're heading, is it a nonprofit registered in a particular state or internationally?
Yes, actually, there is a special status that we as a US, when we joined the World Federation, we didn't have a federation yet, right? So UNESCO Center for Peace was created and represented the US Federation. But the mandate given to me by the National Commission for UNESCO that exists at that time is that we, as UNESCO Center for Peace, over time, we're going to help create a viable federation. The federation was incorporated in the state of Washington, D.C., in Washington, D.C., actually. So we have a legal, but so there's a confusion sometimes between the the UNESCO Center for Peace and the US Federation, and that was because when the whole thing started, UNESCO Center for Peace was given the special status of representing the United States. Okay, so we are recognized at ECOSOC, at the World Federation. We sometimes use the US Federation of UNESCO Clubs and Association, but it's also at the same time UNESCO Center for Peace legal entity. So we are really a 501c3. We are also incorporated. UNESCO Center for Peace is incorporated in the state of Maryland, but the US Federation of UNESCO Club Center Association in Washington, D.C. So it's a work in progress.
The reason I asked is because when you say we could have a chapter in each state. That would mean each one of those be a 501c3.
Okay. The way this will work is exactly how the NAACP work, how the national, many of these big organizations have. There's going to be a 501c3 for the national office, okay? But each chapter will have the possibility of creating their own structure within that. They could also be independent, but on a structure but they could also rely on the national chapter 501c3, because just like others, we would like to have advocacy, people to advocate at local level. So when you advocate, so we, this was set up by me and the National Commission for UNESCO, the rules, okay, the rule of engagement. They wanted to make it so easy that people didn't have to incorporate, they didn't need to incorporate because it was burdensome. A school could just become a UNESCO club and things like that. So the National Federation had all the legal requirement, but we have to be flexible again. It's a civil society. So in the state, in the county, if anybody, there's an application that anybody want to become a UNESCO club record. Actually, right now we have about a couple of them that I need to review. We just fill that form, submit to us, and then we get approved. I review it, get approved. I usually go down and do a training of the new leadership. We need at least 25 people anywhere to decide to have a club, okay, to have a club or a center. And at the state level, almost the same. If you have 25, but they have to spread around the state. So we have a structure. It was designed, it was handed out to me by the National Commission in order how to proceed, but they tried to make it as easy as possible. So a state, a county, a club could decide to be, some actually have their 501c3, but again, it's still under us, okay? Because we need to review. When UNESCO allow you to use the name, there are very strict guidelines. You cannot just use it to do anything. So that's what we need to look after, okay? And they have to submit their report and things like that in case something we can address very quickly. But they are flexible. They could have their own status, but under the bigger umbrella, but they could just be like, okay, just a name, and then we help them. Just like some cities are incorporated, some are not. Okay, some have mayors, some depend on the state. It's a, that's an analogy I would like to give to people. We want to make it as flexible, as easy as possible, so that the idea could really spread around.
Thank you. I well understand. So I just want to confirm that, as you say, that approximately five people could actually begin a UNESCO.
25.
Okay.
Yeah.
In any state, county, et cetera. But these would actually be branches of the 501c3 that's in Maryland or in Washington.
Yes, national office. Yes, they're cool. Yes, they could use, if they need something, again, if there's a donation, for instance, for that branch local, you could come to the national office so that the tax exam is, and then we funnel the to the membership, the membership, the ID card, all are issued through the national office from here. That's correct.
Okay, thank you, Herschel. I'm going to turn this over to you. I've got to make a transition, so I got to turn this back over to you.
All right, thank you. So one of the things that we've agreed on from Friends of the African Union, its affiliates, operations, is that we've agreed that we would provide the framework for the implementation of that vision. And so on these calls, okay, one of the things that we're doing on this call today, on day 2, okay, of the new era, where 1.6 billion people of African descent are together in one organization in the United Nations. And in the chat right now, what I am putting is the affiliated organizations who have been invited to this call, okay, who have been invited to this every day. And the whole idea is that by Sunday, that we will have made a decision on the framework for, as Guy said, in every state, but there are specifically 20 start states, 4 territories in the District of Columbia that either the Center for Peace and the U.S. working group is already in operation, but under the FAU in our model, using a program that we're kicking off in Ohio that is funded to create centers and clubs under an FAU association that each state would then be part of this. Now, we asked those organizations to participate, but we also addressed the invitation yesterday, and it's going to go out for day 3 tomorrow to the ACLU and to the leadership conference, on civil and human rights, which is a 501c4, by the way. It's not a 501c3.
Okay, yeah, that's why thank you so much to say that, because that's why we want local branches or centers to be totally, they want to be independent, they can be independent. They can say we are going to be advocacy, they can say, again, it's about a civil society. And I do something on education, science, culture, communication to bring people together, they are welcome.
Yeah, and so that's why I wanted to make that specific. See, we normally don't deal with the issue of 501c3, 501c4, or C6. We don't deal with the differentials. And so the importance of the leadership, is that it's dealing with advocacy, and 200 organizations. So just like in the National Community Reinvestment Coalition and then in COBRA, we're coalitions of respectively in NCRC over 600 different organizations. And so under that, they would be able to come as individual organizations and individual states that we organize under the agreement that you sent on July 14th, the letter for us. So John, you had a question.
Just to clarify, so audio visually, I'm picturing again the spaceship analogy. That is that similar to what we're talking about, right?
Yeah. So the spaceship analogy is where the International Organization for the International Space Station is a core module. That in the core module, then modules have been added on to it. And those modules then are able to have specialized functions that people can bring in additional modules that hook onto those modules in a planned sequence. And so on April 28th, in the 20th edition of the Indigenous Peoples Forum, we created the Indigenous Peoples Alliance as a framework for doing that, for driven by Black people in America, with partnership with Native Americans in America, that is inclusive of Indigenous peoples of the Americas, Indigenous people of Africa, Indigenous people of Asia, and Indigenous people of Oceania. And that Indigenous Peoples Alliance is reaching out a representative of over 4 billion people for the 21st Indigenous Peoples Forum next year, where right now 375 million Indigenous people are represented. And so we said we would do that in the framework of the creation of a permanent forum on people of African descent, not Indigenous people of African descent, of all people of African descent, which is the 1.6 billion, versus the billion who are Indigenous people of Africa, versus the 300 million of us who are in the global African diaspora, of which in the United States, 30 million of us are an indigenous people created by a plan of action of the Europeans in African slavery who enslaved their own children, like Thomas Jefferson and his father-in-law. And this whole created a unique class of people of African descent who were not indigenous to the African continent nor indigenous to the European, but were indigenous to North America, the United States of America, because our history as a people started there. And so it in some cases, it gets into a whole piece of semantics. Okay. But the key point is we have 1.6 billion people. We have a unique form. We're in day 2 of that era. We decided yesterday for a course of action. We're going to be laying out that course of action tomorrow. Okay. His Excellency from the Gambia has joined us. Welcome, Your Excellency. And so today, what we're doing is we're laying out the scope of work for Wednesday, Thursday, Friday, Saturday for the presentation to the President of the Indigenous Peoples Forum on Sunday for laying out our scope of work based on our conversations with you and others yesterday and with the other groups that have been invited to the table to have these conversations at 7 p.m. By tomorrow, we will have set up an earlier call so that starting on Thursday, that there will be a call at noontime that here in America, that then will be at a better time for those of you on the continent and around the world. Excellency, is there anything that you want to say relative to our conversations yesterday and you going to Ghana? When are you going to Ghana?
Limited.
All right. And so I don't think he can, he's here, but I don't think that he can hear me. Okay.
Okay.
All right. One of the things that I mentioned earlier, this is a business day, and just on the normal course of things that we are adopting our normal business operational stance from Friends of the African Union, African Diaspora Directorate, where Tuesdays we talk about the business of the Black Folks Plan, Wednesday, the healthcare, Thursday, education, workforce development, Friday, human rights, Saturday, international organizations, Sunday, how do we feed ourselves, and back to Tuesday. Queen Mother, Dr. Blakely, she has joined us. Okay. Any updates today, Queen Mother, that you want to give to the floor?
Queen Mother, just want to say that I'm, I don't know if everyone knows that I'm preparing for court to give an oral statement on August the 5th at the U.S. District Court dealing with predatory lending and mortgage fraud. And that people are being evicted for moratorium housing. So that is the focus where Queen Mother is in terms of the oral statement that I will be giving at Thurgood Marshall Courthouse, the U.S. Southern District of Appeals on Thursday, which is August the 5th at 11 a.m.
Good. I'll be getting with you afterwards to have a discussion with you and Ms. Wilson. Okay. And we're going to close out after this presentation. Samuel Baldwin, did you want to give the presentation for Kansas? Samuel?
Oh,
Hi. Can you hear me?
Yes, we can hear you.
Yes, we can hear you. Go ahead.
Yes. Presentation on Kansas. The Nicodemus site.
Yes.
We traveled down to Nicodemus on Friday, and as some of the previous speakers have stated on yesterday, that it was a very humid day. We took a lot of pictures of the township's hall, and
Samuel, before you get into that, maybe you tell people who you are. Okay.
Samuel Baldwin, a member of the agriculturalist African American Agricultural Association. I am a retired individual. I've worked in IT for a number of years, working with a hospital here in Kansas City, St. Luke's Health System. I've worked for MasterCard, FedEx, and all of those companies. I've had the similar roles. They were in IT, managing security, and I'm not talking about physical security. I'm talking about network and IT security, where you're allowing access to and into and out of your network, and you're keeping it from hackers and the bad guys from the outside network.
And so you also served in the military, right?
Yes, I'm a Navy veteran. That's been a few years ago. I had 3 years active duty. Most of that time was spent on a ship at sea. Trained in telecommunications, and after that, I spent about 15 or so years in an active Navy reserve, and that was where I would meet once a month, one weekend a month, and you serve in active duty for 2 weeks out of a year. So that's that part of it. The other part is I grew up on a farm, working with cotton and working with animals. We raise cattle and pigs. So I thought I was getting out of the farm. So I chose to get in the military. And
but you married into a farm family.
I did. And now I'm with the FAU and the Smart Wives Reinvestment Coalition of Chilton County, working with my mother-in-law, Miss Bernice Atchison. We have harvested some forest land during last year, 2020, and we have just negotiated to have another plot of land harvested to take to market. And I live in Kansas City, Missouri, but we get back to Alabama on a regular basis, so we're handling things that way.
And so, for people's information, I asked, because of my illness, I asked Samuel, as the treasurer of the FAU SmartWise Community Reinvestment Coalition of Chilton County, to represent FAU in the creation of operations in Kansas, seeing he was the nearest officer of an FAU membership organization. And to go when the World Conference of Mayors and the Historic Black Towns and Settlements started operations on this past Friday, so did we in Kansas. We had one of our members, Rod Bradshaw, in Kansas when the presiding officer asked for all those organizations who were represented at the table to raise their right hand. Mr. Bradshaw did so, and so started our operations in Kansas. And so Samuel and his wife were there. They took the pictures, they took the video, and we are, as mentioned earlier in the call, going to and work with the UNESCO clubs and centers and associations create that infrastructure in Wichita, in Leavenworth, in Jetmore, and in Nicodemus. As far as I know, those are the 4 areas in which FAU is going to operate in. More details will come tomorrow as we set out. What you saw in the chat is one of the things that we are focused on is the creation of a proposal tomorrow to create an IT system based on a patent pool that would be around agriculture and payment systems for food. And this is right up Samuel's alley, okay, when he talks about network operations, security, and et cetera. He has a lot of questions for me, okay, and I think I have some answers, but the number one thing that we're doing is we're building this network that answers the question from the legacy question of the African Union in 2012, where they tasked us with 5 legacy projects. And we're going to detail our answer to that tomorrow based on communications, computing, control, command, connectivity, countermeasures with an e-commerce solution as part of what we are doing in the Indigenous Peoples Alliance Cooperative of the USA. And it's a system that we call C7. Now, Samuel, I know you deal with C4 as the normal course of things, and so did I. I was a Naval Telecommunications System Integration Command, 01. Okay, and so, but mostly I was a squid among mad dogs. Okay, I did patrol with Marines. Okay, at that time. Okay, I volunteered to do some crazy stuff, including jumping out of a perfectly good airplane. Okay, when I was down in Fort Gordon, and they took me over to Bragg. Okay, but this C7 solutions will have access to global market information and intelligence that has global integration of the UN Sustainable Development Goals. Now, the way we're going to do that integration is through UNESCO. And how we're going to do that integration is through the school systems. How we're going to do that integration is to bring a model program of the United Nations and down home and young people 35 and under in the United Nations program and UNESCO 25 and under. And so that we have that work that together, bringing that integration of the UN sustainable goals that is ultra secure and safe. So I'm a cryptologist, a CTR as they call it. I do the machine, but I have people who are actual cryptologists. That medical doctor graduated from Johns Hopkins, found out he'd rather be a musician, found out that led him to doing ciphers. Okay, and so he created his own cipher that we have an agreement to use that to create our stuff ultra secure and safe. And we call it C7ISR3. And it's a fork not only of an already established patent 5577042, which is a management patent for dynamic bandwidth, smart and secure network that's being used by Intel, Microsoft, Cisco, and 28 other companies. But it's an open source, it's available, just like the Veterans Information System Technology Architecture, which serves the healthcare for 9 million American veterans right now. Not real soon now, right now. There's 23 million American veterans. 2 million of them are people of African descent. Some 400,000 plus are Indigenous people or Native Americans. And that this system currently runs the whole network. And by 2030, they're going to turn it over to another system. But meanwhile, they're going to spend $5 billion to maintain this current system. And we have it running on our computers. And we get the source code. And so we get to adapt it and make it our own to be the healthcare system for Black people worldwide. And so we look forward, we're going to talk more about that, the business of that tomorrow. Meanwhile, I'll take any questions before we go. I'll say hi to Miss Atchison. Okay, she's with us today. We'll reach out to the mayor for coffee. He's with us today. Okay, the Bates family. Okay, they're with us today. And Nicodemus, they want to have the floor. It is theirs. And thank you, Samuel, for the work that you and your wife did. I look forward to the videos, okay, that you have and the pictures that you have.
We're in the process of getting them over to you.
I appreciate it.
All right.
This is John Moss. I just want to add, Rod Bradshaw was great at keeping me in the loop of the activities going on in Nicodemus and some of the networks I've made connection, and he's helped in tying up the meeting with the Potawatomi tribe and Robert Alexander, etc. So he's on the call always. So I just want to say thanks to Rod Bradshaw, Mr. Quiet Man.
All right. The Bates family, did you want to have the floor? To talk about Nicodemus, about the reunion? All right.
Yeah, well, I'm here with my parents, and yeah, I mean, the celebration was great. Yeah, it was full of activities, a lot of stuff, especially going on Saturday, and it was just wonderful. And so Herschel, I mean, I just want to really thank you for any part or efforts that you had in the funds that the Historical Society was able to receive. So that was just a really surprise to us all, a wonderful surprise, and so much that they'll be able to do with that. It'll help them to be able to achieve some of their goals. So yeah, but
well, that's part of our fundamental goal is that to embed this in our history. They're following a historical path that, like what your father told me about, that history of Black women who were raped by European men and their children who were born. And he told me a little bit of that story that was uncovered by this reunion. It's an American story. And Nicodemus is our ground zero for that story being told. So look forward to it.
That was wonderful. Dad and I, we did get to meet Samuel Baldwin and his wife, and you got to take a picture. So that was really wonderful. And we, of course, met up with Rod Bradshaw, and yeah, and I was able to take the mayor Johnny Ford, Honorable Johnny Ford, around and show him some. He went to there's a memorial service, and so he did attend that, and I was able to get a picture with him. So that was really exciting. So we missed you, Herschel, but it was a great weekend and a great turnout.
Yeah. Well, I officially out of doctor's care today. Okay, and they told me to come back in another week. I'm going to get to Nicodemus on my western journey to California. I plan to stop in Kansas and Nicodemus and Oklahoma on my journey, my sojourn to California in the coming months. So I miss meeting all of y'all at the same time. But you know, as they say, Zoom is the second best thing to having face to face.
Indeed.
And I hope you guys got a bison burger as well from the Potawatomi tribe.
Definitely. Oh, they were delicious. Yeah, that was just really awesome to have the Potawatomi Nation tribe with us. So that was really just wonderful. We really enjoyed that. It was really good. I don't know if Chris Hildebrand is on the line, but we also got to meet up with him. So I don't want to forget anybody. But I think Dad may have something he wants to say as well.
Okay, can you hear me?
Yes.
Can you hear me?
Yes.
Yes, sir.
Yes, we can hear you.
Yes.
Okay, how's everybody doing today?
We're doing good that you're with us. And Mr. Bates is a Pickford era farmer. He is actually a named litigant on the suits. He's not part of just the class, but he, like Bernice Atchison, and is a named in the suit. And so, Mr. Bates, the floor is yours.
Okay, I want to tell a story like I started telling you yesterday about I've heard for years and years that you know that the slave masters raped the women and killed the kids and did everything. And as I got to Nicodemus this weekend, there was a white guy there that was there by the front of the hall talking, and I heard him say Malala Cemetery. That's where my folks are all buried. And we got through talking, and I asked him, I said, what about Malala Cemetery? He said, well, that's where my great-great-grandmother's buried, Effie Moore. I said, what? I could not believe it, you know. And I said, well, I know her. I used to visit with them years ago. They lived upon the hill there. So I talked to him several times, and he really enjoyed that. He said, well, I can go back now and tell them that I met a guy that knew my grandmother. And he said his folks, he argued with his folks for years and years because they didn't want to accept that, you know, they had black in them. So but he finally come to Nicodemus, and he showed me pictures of his family. I could see the half breed, you know, like myself kind of. And he showed me a birth certificate of one of his brothers or something other, and it had Negro wrote on it. I said, well, he's telling the truth. But he said he's coming back next year again, and he says Effie Moore was his great-great-grandmother, and I think he's telling the truth.
There it is. There it is. And that's our history, that we have to deal with our history. And so if nobody else deals with our history, we have to, which is the importance of Nicodemus, because the Nicodemus Historical Society is in a location that has that history between us as Black folk and Native Americans. And the importance that the town of Nicodemus would not have survived in that first year if not with the Native American assistance. And so that's a story that we don't learn in America about the survival of us as a people today was dependent in grace of people in yesteryear. And this is an American story. It is not just a Black or Native American story. It's an American history story. And so I look forward working with you and others to make sure that story is told. And also the conclusion that we're dealing with this week for what we said we would be doing in the 4-step process for Pickford farmers. And so thank you, Mr. Bates, for your time, and thank your your wife for her and the pain that we felt when she talked about her experience that your family felt by the misactions of the United States Department of Agriculture. And as Queen Mother, Dr. Blakely says, there's some things that money can't buy the pain that has been incurred by actions of our government.
Right, sure right. She's sure right.
But money can help create intergenerational solutions. And that's what we're looking for.
Amen.
And so to that end, I will turn, if there's no other questions.
Yes,
or other
hi,
comments.
hello. Yes,
Yes.
this is Linda Jones.
Yes,
I
I'm
wanted
sorry.
to say, yes,
Sorry.
I wanted to know that I was in Nicodemus also. I'm sorry that I didn't get to meet Mr. Baldwin and I think Hildebrand. I missed them when I was down there, but I was working. So I was there. We had a great parade. With the Potawatomi Indians, they let it off for us. So I was helping with the parade. So I got to meet some of them and talk to them. Also, I finally got to meet Mr. Bradshaw that I talked to all the time and never seen him. But we did have a pretty nice homecoming, and the parade was wonderful, and receiving the donation was real nice for us, and we can use it in some place that we will need it. And we really appreciate you guys taking the time and coming up and, you know, visiting with us and checking it out. I didn't get down to see the church either. I wasn't there for that opening, but it does look nice. And it was really nice that everybody did come up and see, you know, and visit with Nicodemus.
Well, we'll be back next year as a group, but this year, for the end of this year, it's my intention to be there in person. And I appreciate the time that everybody did and the graciousness of everybody coming together. We kicked off action in Kansas. Let's make it stick.
Yes, yes. Well, we appreciate it, but it came out pretty decent after being shut down for a year. Although we were virtual last year, but it's not the same. It's nice to have it, you know, in real person, everything. So it came out pretty good. We worked all year on it. So it came out pretty good considering.
All right.
One last thing. One last thing.
Yes.
Okay. So before we conclude, I think something that the U.S. Federation and UNESCO Center for Peace has been doing every year is to celebrate the African Heritage Month. And, you know, we are almost a month away from that. And just want to, I think that may be the first collaboration, the first initiative between the U.S. Federation and FAU. So I just want people to be aware that the African Heritage Month is coming in September 12th, and we hope by, you know, very soon I'll be working with Borashi to have an agenda. We may still do it virtual this year because of the Delta that's coming, but hopefully by next year we'll be able to have a face-to-face visit. And as I was hearing you talking about, I would see how we could be having the convention, you know, and another convention for next year. That's something that we can also start to thinking about. Okay, that's all I wanted to say before we conclude.
All right. Well, thank you.
So really quick, can I, Herschel, just say this is sort of a plug, because so many people are not aware of the work or the mandates of the 400 Commission. So it was our, the 400 Commission, the 400 Years of African American History Commission presented a non-competitive grant to Nicodemus Historical Society for $10,000. So I just wanted to put that plug in.
There it goes. Thank you, Commissioner. And
Thank
so
you.
the type of work that the commission can do is one of the things we're about to ask the commission, as the commissioner said, to write it. There's a proper way to do it, and we're going to follow that proper way to make that happen. Mary, I understand before you want the floor. Go ahead before we close out.
Thank you so much, Hersho. Yeah, I was just reacting to the two programs that Guy is talking about. Be it the Black Heritage Month, how do we really engage the young people in this? I've been all the time trying to see, we are talking of even the school programs. The other day we are talking with a group on our side, trying to see how we can, maybe through clubs, we can bring in a notion of combined club discussions within schools on racial issues, and we get those conversations out there among the young people, be it the indigenous group or even the African Americans group, but also the white communities.
Oh, of course.
If this money is going out, it's not. We shouldn't just get money and eat, and then by the end of the day we are back to square one. Before this money is gone, let us count tangible outcome that this money has left us in the hands. Otherwise, the money, I care less on it. I care more on the tangibility, changing lives.
So in that, one of the things that most of our youth have no idea that there is an Agenda 2063.
Then we need to teach them.
But wait a minute. We have an ambassador from the AU who's all about that. Okay. And so August 25th, and I'm going to talk about this tomorrow, but August 25th, we're looking to be in Washington in Africa House and to have also it on Zoom on the organization of how we tell to young people, okay, that the whole idea of us organizing is there. There's an infrastructure that is there, that has been put in place for that, and that, you know, we have some ideas on it, okay, that was put together for it. And under UNESCO, one of the things that I opened the Center for Peace was to, on their youth, was to talk about the permanent forum. And Guy told me he had all sorts of questions ongoing.
A lot of questions. Actually,
All right. Yeah. And so
actually,
go ahead.
Because of you, next year, because again, we have different committees when they get together. One committee, the Security Council, the Assembly General, the African Union. They say that next year when they get, there's going to be one committee on the Forum for People of African Descent. Actually, that was decided by after your speech.
Yeah. So Mary, in terms of what we put together for the diaspora, this organizational infrastructure, is we're now in the process of modifying this as of the discussion that we're going to have on day 3 tomorrow. So I'm naming these as day 1, which was yesterday, day 2, day 3 is tomorrow.
Yeah.
Okay. And day 3 tomorrow, I'm going to lay out this structure that you see here. Okay. And modify it as for the permanent form, because this was based on the diaspora only, not all 1.6 billion. But you see that part that's talking about Secretariat. Okay. In terms of the Secretariat, the planning on this has already been submitted to the US government. It was submitted to the US government January 2020, January 27th, 2020. Okay. And so when we talk about it, okay, you know, this is already something that we talk about integrating what you're doing for democracy, okay, and what others are doing in this forum, that we can bring it all together under unity, self-determination, collective work and responsibility, cooperative economics, our purpose, our creative class coalition. That's what the UNESCO Alliance gives us the form that when we go to do this at a state level, at a local level, and they ask, well, where's your connectivity? That's one form of connectivity. The Center for Peace is in ECOSOC status. The Future Foundation is in ECOSOC status. Edfu is in ECOSOC status, and the others that we invite to the table. So that's what I was saying on the next 5 days, that we need to put this together. And, you know, we have our stuff, and that's why we reached out to Guy, okay? Because what we have is, you know, not only as a 501c3 with over 20 years of audited financial statements, okay? But this whole infrastructure that is on the screen right now is in the United States government, okay? So now within the context of us in this permanent forum, okay, we have to decide how we want as civil society to organize. And so tomorrow's, that's going to be, health is usually our discussion tomorrow, but this supersedes it in terms of talking about the structure that we're going to organize in. And yes, Mary, I'm making the call again to have everybody on the line to talk about that for here in the USA. On the mailing right now, I've got 200 different organizations and et cetera. And feel free, I'll be sending to you the invitation for them to come to the table tomorrow, and we'll see what we can get done.
Okay, thank you.
All right. Any other questions? All right, Queen Mother.
Yes, Mr. Chairman.
If you could give a reflection on day 2 and as we go about our business.
Thank you. In the spirit of our ancestors, full moon. The full moon radiates the beauty of the light and so bright. Move away and disappear from our sight as we listen to the sound of music with the tapping of our feet to the beat of concerto in G major, swing of our heads in a melancholy mood that causes us to be in a rhythm of ease and content. Set us in a tone that can connect us to our inner soul in search of the pleasure of you, the Most High, Almighty God. In your infinite assembly of perfect pitch, full of joy, happiness, as we witness with the naked eye, your wonder and splendor as the full moon spins and turns for everlasting. In the company of you, our maker, our creator of all times, the full moon awaits us. So be it. So be it. So be it. Amen.
Amen. Amen. All.
Amen.
Amen. I hope.
Amen.
Amen.
So with that, this call is now ended. We'll be back here tomorrow at 7 o'clock to set the format for civil society in the permanent forum on people of African descent in the United States of America.
Thank you.